mental health, this has been a very challenging year for all of us. We didn't know what pandemic was, what it meant to live a life where you are in lockdown. So it has affected our emotional, mental, and physical health. And we've survived it. We are here to talk about it and reflect about it. So we did a few things through the chapter. We did a COVID stories. If you have not had an opportunity, take a look at the website and you'll get to see some of our young ones and adults share some of their beautiful journey, their anxieties. And today also we'll discuss some of this. So I'm very fortunate to be a co-panelist with two wonderful ladies who are joining me today. They're both, I'm very fortunate to call them my friends, as I have interacted with them through this chapter. I got to know them, and it's been a real pleasure. Every time I have a conversation with both of them, I feel like I gain more information, I gain more knowledge, and it is very enriching for me. So I hope that that our audience today will feel the same a little bit. So they have also, like Shlok told you guys a little bit about me, the talk sped that I'm doing. So I want to share a little bit. We want our audience today to know a little bit more about my special friends. So I'm going to begin with Nivedita. The way I got to know Nivedita was she did a talk for us a couple years ago at my home. We had organized an event with South Asian Heart Center where she was also talked about pediatric health, about obesity and healthy eating habits for children. So it was very informative, and every time I've reached out to Nivedita, she's been on my channel as a guest, and I really enjoy and learn a lot from her. So Nivedita, tell us a little bit more about your journey and what brings you here.
Hi, I'm Nivedita More. I'm the wife of IIT alum Nitin More from 1984 batch, and that's how I got to be on this panel and got to know Namita. So my journey started with marrying Nitin in the 90s, and then spending some time in Europe where we had our children, then coming to United States with the green card. You know how the immigration stuff goes. So 3 years in Europe with two children, and after landing here, decided to do pediatrics after having done medical school in India before marriage. So that's how I landed here in pediatrics because of my kids. Really, I have to thank them for that. We chose to live in Orange County for about 19 years. And then when my son decided to take a job here at Google in the Bay Area about 5-6 years ago, we decided to come back here because Nitin had a lot of friends here from his class. And my best friend lives here. So here we are. 4 years ago, I decided to join Stanford Children's. And as part of that group, I also get to practice at Stanford Healthcare at Cisco. I'm on campus at Cisco 4 days a week. So that's how I got involved with this panel today.
Thank you so much, Nivedita. It's so good that you're back in the Bay Area. So we're very happy that your connection is come to a full circle and we get to see you more over here. Sushma also has a very interesting stories as about herself. And before she begins, I think Sushma and I had the fortune of doing some co-presentations in the past. And it has been anytime Sushma is part of any activity that the chapter is doing, whether it's a social get together or we do just a paintings class we have done in the past, what it does is everybody wants to talk to Sushma. So without further delay, let's go ahead and listen a little bit about her career journey and how she ended up doing what she does. Go ahead, Sushma.
Okay, so I did my master's from IIT Kanpur and I did my PhD in physics from IIT Delhi. So I have friends in both IITs. I met my husband Shrikant at IIT Kanpur, and we've been married for, believe it or not, for 46 years. I worked in academia and in high tech for many years before I decided to go to school to learn about counseling psychology. And that was a really intense experience, and I'm glad I did it. I'm now a licensed marriage and family therapist, and I have a private practice in Mountain View. So if anybody is considering a career change and feel they're too old, don't even think about it. I went back to school at 50, so anybody can do it.
Wow.
And it was a
Yeah.
very enriching experience. Yeah,
Wonderful, Sushma. That is such a testimony
yeah,
to, follow your heart. Doesn't matter what age you are.
absolutely.
Yes.
Yeah,
So,
yeah.
welcome both my co-panelists as you get to know them a little bit more through our conversation today. Like we said, it's been a year where life has changed for all of us. So let's begin with Nivedita. Can you share a little bit more about what are some concerns that you see that parents and children are bringing up, especially during the pandemic?
Definitely. We've seen a lot of COVID cases, more so in adults than children. But I'm really seeing a huge impact of this virus beyond the infection. I'm definitely seeing a huge growth in behavioral, emotional, and mental health illnesses in the past year. Um, some of these in the infants and young children can manifest just about as distress through disruption in sleep, in toilet training delays, feeding issues. They may have some difficulty with separation anxiety and regress in their skills or become more irritable. I was just talking to one of my patients the other day who's 2 years old. It's one of my colleagues' son I was seeing in practice. And I said to her, wow, this child, half of his life, he has been in a pandemic. It's really distressing, with that age
Mm,
group because they really are so disconnected from the outside world. It's really hard. In some of the older children and in the young adults, they may express their distress by internalizing symptoms, particularly such as withdrawal, fearfulness, overt anxiety. Some of the times, externalizing behaviors such as lashing out, oppositionality, irritability, aggressive behaviors. Sometimes I even see some complaints like headaches or abdominal pain, which is secondary to stress rather than actual like disease. So I've really been really tuned in to these concerns through this past year. In some of the older adolescents, I see children all the way up to 22 years of age. So in some of those kids, the older adolescents and the young adults, they may be able to verbalize their distress, but may also purposely hide their concerns and share just, very few things sometimes with parents, or may not share anything at all. And some of those behavioral manifestations can be fear, shame, sometimes sense of responsibility to avoid burdening others. They feel like the parents have too much on their plate already. They don't want to share anything with them. And some of the distress can also present as irritability in them, lack of concentration, declining school performance, and even substance abuse for that matter. So um, I'm really mindful of all this when it comes to practice. These are some of the emotional and the behavioral things I'm seeing, but I'm definitely also seeing a huge uptick in mental health illnesses in practice, including depression, anxiety, like Shlok talked about. I'm seeing some attention deficit disorders, eating disorders, which are really
mm,
across the globe. It's not only the specific prototypes that we used to see in the past, it's in all communities, it's in Indian population, Asian population. I'm also seeing a lot of PTSD from all the missed school in this past year, a lot of post traumatic stress disorder manifesting in various ways, as I just described earlier. And some of it is also from, believe it or not, sexual exploitation that's happening online. So really be mindful of where they're going online in terms of, screen time. Um, I'm seeing some weight gain in practice across the board due to inactivity, increased backaches due to prolonged sitting for school and schoolwork, vision disturbances, definitely with increased screen time, and people are skipping their optometry appointments annually because of the pandemic. And now that the kids are going to be going back to school, I'm extremely worried about sports injuries because they're not going to ease into the sports, and I'm very, very worried.
Right.
So that's where we stand with most of the pediatric stuff.
Yeah, no, thank you, Nivedita. You bring up that holistic, the mental, the physical, and the behavioral health that has really taken a hit in this year, and how difficult it is to, as we plan for this reopening. And I'll talk a little bit more about it, but let's hear from Sushma. I know, Sushma, that in your practice, Nivedita shared a little bit about those anxiety, depression, and increase in mental health issues that she's seeing in her practice. What is it that you see, and are there certain age groups and genders that are reaching out more for help and support?
Yeah, COVID has affected people in different age groups differently. So Nivedita talked a lot about children and young adults. In my practice, I have seen teenagers, especially high school seniors, feeling very distraught about not being able to interact with their friends, and especially seniors, because they miss out on a lot of experiences that are so critical to their last year of school. And also when they go to the university, I mean, first year of college, staying in the dorms is so iconic in a way, learning and learning. Parents are very overwhelmed. And also young singles, that is 25 something professional people who are new to the Bay Area. Isolation and loneliness is weighing really heavily upon them. It's very, very, very distressing. I mean, I can't even emphasize it enough. All the people who I talk to, they are who are young, they're all very, very unhappy about the whole thing and very distressed. They start getting depressed and anxious and start obsessing about things. And one more group that came as a surprise to me was 50 something adults. And it's those adults have gotten used to a way of, you know, people work in different places, their interaction with each other, if there are two people, is somewhat limited, and they get used to that lifestyle. And now both people are at home and they're getting on each other's nerves. And there is a lot more to do, and their children are getting distressed. So I get calls from 25, 30-year-old people basically saying, can you help my mother? Can you help my father? And yeah, so COVID has affected people in different ways, and it will be interesting to see how it evolves when the whole thing is over.
You're right, Sushma. Yeah, thank you so much for highlighting some of the, the distress in the community and I'm glad that they're reaching out for help.
Yes.
To me, that is the positive light, because I think the stigma,
Yeah.
the just the fear of seeking support in our community is still very high. So and that is something I wanted to highlight also, is like being part of the public school system. One of the things I want to just say it out loud to this community, and here I know a lot of people may know it, but I wanted to stress the fact that there is a lot of support out there, even in public education systems. So,
Yes.
through the process of IEP, through the process which is individualized plan,
Mm-hmm.
where once a child gets a diagnosis from a pediatrician or a psychiatrist about having anxiety or depression or any of the mental health issues,
Mm-hmm.
or any physical disability, ADHD or
Mm-hmm.
hyperactivity, there is a lot of support system and
Yeah.
services that are available in public schools, and make use of them. We have mental health support available. We have wellness counselors at school. We have behavior specialists. So these are all
Mm-hmm.
support services that exist. If your child is taking medication, to get it on time, to get it at a
Mm-hmm.
certain time, all kinds of supports and services exist. Sometimes I think it's just the lack of awareness that these are part of school system is a little bit of a barrier in affording them. So let's make sure that we encourage parents and encourage young teenagers and adults, in fact, to reach out and seek these support. The other thing that both of you have talked a little bit about, and Sushma, I want to begin with you, that we talked about these distress and other mental health conditions that really impacts how I feel about myself. But what is it that, especially in our community, with the Indian community, how can we identify, and before it really starts impacting our relationship and that withdrawn that you're talking about, the loneliness, is there something more that we can do, or what are you seeing, and what is your thoughts on those?
Well, it all starts with awareness. When we are aware, we can help ourselves and we can help others. Uh, so for example, teenagers, depression and anxiety are very common amongst teenagers. If they get help early, it can be handled much more easily and much more uh, in a timely manner, so to speak. But a lot of times when I see teenagers, they are really, their situation is pretty bad. They're really very depressed at that time. And and there is a lot of resistance to medications. Parents don't realize that, mental health issues are a lot like having diabetes or having high blood pressure, except that most of the mental health issues are episodic. So you don't have to keep taking the medication. It's not for life,
Right.
right? So, but medications help a lot. Medications and therapy together works well.
Absolutely, absolutely.
Okay. And it is really effective, and it can go a long way towards for people having a fulfilling, happy, purposeful life.
Right. Nivedita, would you like to add some more light on how you approach some of these issues in your practice?
Yes, so to address the previous question for children specifically, I think parents need to reach out to their pediatricians because during the pandemic, it's been really hard to get people into our offices for their well checks. And right now, most insurances are allowing us to do well checks even via telehealth. So I would highly encourage all parents here to get their children's well child checks on track and also their own well checks on track. All the healthcare workers now in most of the country are vaccinated. So it's a very safe place. We have had no transmissions of COVID in our offices. So it's really important that they connect with their pediatricians. And this is more important for the 12 something year olds because routinely we screen for depression and anxiety during our visits. And this is discrete screening that we do in our practice. So it is without the knowledge of the parents. They are supposed to answer confidential questionnaires regarding sex and home and reproductive health and smoking and alcoholism and mental health. So all of that screening is done unless there is any harm to their life or somebody else's life, we are not supposed to disclose that information to the parents. They have their own portal via which they can send me messages and connect with me that way. So I highly recommend that they connect with their pediatricians on this topic. A lot of these concerns tend to be mild. As Sushma said, she sees like the worst of the lot. But for my practice, we sometimes see a very mild situation which can be eluded or eased just with some counseling, and maybe even talking to family members or with peers or with counselors at college or school, like Namita has those resources from schools, right? Those can be definitely utilized. But a lot of the mental health resources need to be accessed for those who are moderately or severely depressed. And some of these are available actually through the parents' employers for 12-something-year-olds. So some of these apps like Vida and Noom have a behavioral component to them, and that can be accessed. EAP, which is your employee, it is employee
assistance program.
Thank you.
Yeah.
Has few therapy sessions that can be accessed through your parents' employer. So those are things that I would highly recommend at this time for the children, especially.
Thank you. Thank you so much, Nivedita. Just adding to the same thought that we were talking about earlier, are certain age groups and minorities specifically struggling that you notice right now?
Oh, absolutely. Yes, along with the teens, that Sushma talked about and I talked about, the LGBTQ community is definitely struggling with the pandemic and during the pandemic. And some of these LGBTQ teens and transitional age, especially the transitional aged LGBTQ kids, are unfortunately in families who won't accept them, especially in the Indian community. I see a lot of that. For who they are, and they are not ready. The parents are not ready. The families are not ready to accept them for who they are. So they remain closeted while they're at home, and when they go off to college, they find counselors, they find friends, they find people who will accept them for who they are. Last year, when the pandemic hit, all these kids got sent back home into the same environment that they had left and were free to express themselves and to express their own, status and their own being. And here they are back in that same environment, which made them really sad. And that's been super challenging for these children. So I recommend, and we found this out more like 3 months into the pandemic. CDC has data on this actually, where they looked at numbers, the phone calls that were being generated via the crisis helpline for this particular population. It's called the Trevor Project. And their phone calls went up by 50% for the crisis line. So that's when we knew that these are the children who really could use some extra help. The teens, on the other hand, are trying to seek help, also including mental health. They are also trying to get some help for their reproductive health without the knowledge of their parents. And parents, if you like it or not, these children are going to get what they need. So I say it's better to be safe than sorry. We definitely don't want a pregnant teen, and they need to get access to contraception, to condoms, whatever they need to live life and be the teen that they are. So I am noticing a huge uptick in sexually transmitted diseases because of inaccessibility. I'm seeing a huge uptick in eating disorders. Again, our community is not immune to that. I have some Indian patients who are struggling with anorexia, with eating disorders, and they should be encouraged to talk to their doctors and therapists privately so that they can open up with their providers and get the help that they need. There are programs like Family Pact in the community by the government in the state of California, which is free for reproductive health. And also it can help them prevent unwanted pregnancies, basically.
Sure.
So really those two main groups are really struggling, I think.
Yeah, no, thank you, Nivedita, for bringing light into, also you gave some good ideas about how we should be engaging and coming back to seek support from physicians and encouraging parents. But yeah, I mean, the fact of life is in pandemic, it's that same four walls, and the people who had left the house are back in the house. There are pets in the house, and with everything around you, you are always on screen. Most of the people, there are many people who are fortunate to have a bigger home where there is less of a distraction. But you'll be surprised at the way when I see some of the online classes that are going on, distance learning, and how, there is a major concern of equity of resources in our country that has come up. How to access these resources has come up, and there's been a breakdown in services, especially for those who are cognitively challenged, who have behavior issues like we talked about, and children who are needing that expert help. Parents are not therapists, parents are not teachers, and they, for younger kids, for preschool age children, for 5 year olds, for 6 year olds, it was very difficult to comprehend. And like everybody has shared, we are now coming to the point in the Bay Area where we are preparing schools to get ready to receive children back. There is this glimmer of hope that we are coming back to a new normal, and we are all looking forward to that. However, there's a lot that we are also anxious about. You wouldn't believe how many meetings on reopening I have attended in the last 2 weeks, because Santa Clara Unified School District is preparing to come back on the 29th of March, as we hope we continue to see a significant decrease in COVID cases and more of the educators getting vaccinated. So, I mean, we have shared some fears and anxiety that exist in our community, but we have also stressed on the importance of reaching out for getting the right help. And the time is right now. Like, yes, there are, reasons to make sure you practice all social distancing measures, but reach out and get those services, much needed supports and services, which are available to you at no cost and sometimes through your insurance. So explore and reach out, and definitely overcome some of these barriers that can be helped right now. So with that, let's kind of go around and share some thoughts and some tips and resources. And I'll begin with the whole idea that I've talked about, is that coming back. So one of the most important thing will be taking a look at what your schedule looks like, what your routine looks like, especially for those younger kids, the preschoolers who've enjoyed being at home and not getting up in the morning. I couldn't, I can very well relate to the comfort that has been for this year, but all my teachers are like, pulling their hair out and asking for one-on-one support with every student when they come back on campus. So as parents, try your best to get them in schedule as much as possible. Work with them for the little older ones who are with you. If you can find a moment to do some family activities together, whether it's a walk in the block or just painting some rocks together, whatever creative ideas they have, just encourage that, and then give them choices, give them some control on their schedule, let them choose what they want to do or maybe eat today. And I know it requires more time on your part, but just letting go of some of that, and getting more involved, and just talking a lot with them, checking in with them when you go on those walks or a little ride, and things are opening up. So just getting outdoors. Nivedita talked a lot about obesity and just not being physically active, losing that whole part of your life where you were engaging in sports and you were engaging in team games, are eventually and slowly going to get back to you. So kind of revisiting those thoughts and ideas and talking to them as much as possible would be great. So Nivedita, just add a few more thoughts you have, and then I'll get back to Sushma before we open to the audience.
Sure, Namita, thank you. Yeah, those are some excellent points, Namita, you have made. And, along with that, I think having some downtime with your children, just unplugging, relaxing, meditating, for example, are awesome. You need to carve out some time as a family to do that if possible. Just even breathing, all of us are wearing the Apple Watch now, and it comes up all the time. How many of you are actually doing it? Not sure. So just carving out some time, just to take that step back and just breathing throughout the day, even for 2 minutes, makes a huge difference for these children. Establishing guidance on screen time, I am really big about this, only because, not just because I'm a pediatrician, because the more time they're spending on the screen, the more visual problems they're having, the more depression they're having, the more obesity they're having. So I worry about inactivity a lot with these children. There is a great tool on the American Academy of Pediatrics parenting website, and I'm sure Shlok will share that separately in the chat later. And that's healthychildren.org. And we have a media plan that is devised. It was pre-COVID. It was talked about since 2016 now. And it's a great tool for different ages on how you can minimize screen time as a parent and as a family, maximize outdoor time, at least 60 minutes daily, and eating healthier. Even turning a simple solution is to turn off the television or any screens at the dinner table. And a great way to connect with your children. I know most children, especially teenagers, are choosing to eat in their bedrooms. I would at least try to spend one meal as a family together. That is huge, because that is the time they will open up. Talking about your day, especially what's the good part of the day, what's the bad part of the day, what was the high, what was the low. These are open-ended questions you can ask them at the dinner table, which will connect you with your children. Staying active, again, eating healthy. We have an acronym in pediatrics called 5210, let's go. And that's talking about 5 fruits and vegetables daily, less than 2 hours of recreational screen time. I know it's unheard of these days, 2 hours is like impossible, but at least try to minimize as much as you can, especially with the video gaming and the passive watching. So it's okay if the teenagers are connecting socially with their friends online in group chats and Zooms or whatever it is, but just passively watching TV or video games, or, binging on series for hours on end is not helping anybody. Staying active, we talked about. Prioritizing sleep. This is huge for me. Especially in the pediatric community, we have lobbied at the state level and nationally to start the school times. In 2023, we're going to start the schools at 9 a.m. I don't know if parents are going to like that, but the kids are definitely going to love it, and the pediatricians are going to love it. So adequate sleep is very important. We want 8 to 10 hours for the teenagers, and for the younger kids, 9 to 11 hours of sleep is great. So having that bedtime routine, winding down an hour before bedtime. The LED lights in our homes are not helping the children sleep. It's not helping secrete the hormone that they need to fall asleep. For all of us, we need to turn off the television, turn off the screen at least an hour before bedtime. So I usually recommend no screen time after dinner times, just wind down, relax for that part of the day and really try to take it easy.
Thank you so much. Yeah, sorry if you haven't.
Yeah, just one last thing, just being aware of the behavioral changes, feeling stressed, angry, sad sometimes is common, especially in these times. But more and more children and teens are finding it harder to cope during the pandemic, and cases of anxiety and depression are definitely rising, as you know. So just being aware of the change in their behavior is super important at this time. yeah, that was my real
That's a great
parting.
segue to talking about, overall, we have shared some tips, some ideas, and then we heard. But the main thing, I think, Sushma, let's get back to, this is not just related to pandemic, right? Like our mental health awareness, our awareness of how we react also to some of these concerns. When you shared a little bit about that, the communities, there's still very strong stigmas in getting these supports, reaching out. So what advice do you have for us today?
Well, with pandemic, isolation, loneliness, and being overwhelmed have been the critical things as far as most families are concerned. But we have to remember that there are a lot of other mental health issues and problems that society has, every society has, and our community has them as well. I mean, percentages are the same. So, what are those issues? Just this, what happened in Atlanta just a couple of days ago, that put the focus on sexual addiction in a way. But addiction is not just sexual, addiction is video games, addiction is gambling, addiction is food, addiction, people can be addicted to a whole bunch of things. And of course, alcohol and substance abuse and things like that. And these are extremely common. And they really affect families. They affect children. They affect, just the whole family. And these are things that we need to talk about, and people need to get help because addictions can wreck the families. Absolutely. There are also, we talked a lot about depression and anxiety, bipolar disorder, okay, a whole lot of other obsessive compulsive disorders, phobias, anger issues, domestic violence, personality disorders. And there are so many things that affect our mental health, and they're treatable.
Yeah.
They're very treatable. It takes a little bit of time, but we really need to be aware of it. Delusional disorders. How many people know about delusional disorders? Okay, but they are very common. They are very common, and they're painful, and they're treatable.
True. Very well
Right?
said.
So these are, I mean, people need to look at mental health, mental illness in the same way as they look at physical illness. When you are in pain, you go to the doctor. When you are in psychological pain, go to a psychiatrist, go to your doctor, and let them, and if they say go for therapy, go for therapy.
True.
Okay?
Thank
It
you.
takes, yeah.
No, that is very true. I think in our community, the more we can have conversation or at least get started in talking about, you alluded to it earlier, about just the awareness and, just
Mm-hmm.
taking that first step. And then, of course, seeking the support. Like I said, many of these services, when it comes to school system, is all in public schools. It is all free. So, it's that first step of having those conversation, and it's a journey, for parents. I do want to say that, I've my whole 25 years of career, I'll say that I interact with families with the special needs, and I can tell you that it's a journey for a parent, for a family, and
Mm-hmm.
it has to start somewhere. So,
Yeah,
if we
and
can begin with conversation, that's a good start.
in families, mental health issues affect families very intimately.
Exactly.
So,
Relationships, yes.
relationships intimately, and sometimes problems in relationships are the first indicator that something is not right.
True, true.
Yeah.
So, thank you for this wonderful conversation today.